few important spotters here. Orbicularis oculi, parts and nerve supply are important sub-questions. And here you have the masseter muscle. Nerve supply and action is important. If I reflect the masseter, you could see the maxillary artery inside. 3 parts of maxillary artery, the origin are important. First part and third part branches are very important. And the maxillary artery is being divided into 3 portions by the lateral pterygoid muscle. And you have 2 nerves here. One is the medially placed is lingual nerve, which goes to the tongue, and laterally placed is inferior alveolar nerve. It is not seen clearly. I will show it in the next slide. And then this is your platysma, the subcutaneous muscle. Nerve supply is important. And then down, if you see, this is sternocleidomastoid. The origin, insertion, nerve supply, action, all are important. Clinical application is also important, that is Reinecke. And this is the vein which is lying on the sternocleidomastoid, that is external jugular vein. So the vein which lies on the sternocleidomastoid is external jugular vein. The origin, termination, tributaries, all 3 are important. And then reflected, you can see 3 important structures inside, that is common carotid artery, vagus nerve and internal jugular vein. All these 3 together, it is called as carotid sheath. And the carotid sheath contents anteriorly what is there, posteriorly what is there, all are important. And then reflect this, you can see beautifully the brachial plexus. So just in front of the brachial plexus you have a muscle, that is your scalenus anterior. Over the scalenus anterior you have a nerve, that is your phrenic nerve. Okay, behind that you have scalenus medius and posterior. So this is one important spotter, scalenus anterior with phrenic nerve. And then you can see the subclavian artery coming here, and then one branch is going deep inside that, that is your vertebral artery, which goes to the C6 vertebral foramen. Okay, foramen transversory. Okay, then the branches of vertebral artery are important, and thyroid gland is here. And then if you come to the opposite side, here also you could see the platysma. You could see the tortuous vessel, that is your facial artery, and nearby the straight vein, facial vein is seen over here. And then next is the arteries, already we have showed. Facial artery grooves the posterior superior surface of the submandibular salivary gland is seen clearly. And the vein, the facial vein joins with the anterior division of retromandibular vein and drains into internal jugular vein. And the posterior division of retromandibular vein joins with posterior auricular vein and forms the external jugular vein. Okay, these 2 are very important. And this one goes up, submandibular salivary gland is seen clearly, and this side you can see the parotid gland, parotid duct. Okay. Three structures. This one is divided into external carotid and internal carotid arteries. You can see the 2 divisions of external and internal carotid.